How are you?
I'm fantastic. Thank you so much for doing this again.
My pleasure. Good to see you.
Good to see you. Sorry, I'm just thinking about going live on TikTok so people can kind of post questions if they have any.
Okay.
Didn't tell anyone about this. I just have our list of questions, so I think we're just going to go with those.
Sounds like a good plan.
Oh goodness, sorry.
Sometimes it's hard, writing answers are hard because there's nuance in answers.
Mm-hmm.
It would be a lot easier if all of admissions was just black and white or very concrete, but it's not.
Yeah, that would be way too easy. Well, and also for a program like yours, it's not. For a lot of programs, they're a little bit more black and white.
Yeah, I think I think to the detriment of the people that they actually accept.
Yeah.
I think there's a lot of really amazing applicants where your GPA or a few criteria doesn't really tell the whole picture. So it might be more efficient to do things that are black and white, but they're not quite I think there's beauty and nuance in everything.
It's a wonderful way to say it. I was actually wondering about that because with your program getting more and more popular and more competitive, I don't know if it's just the field in general getting that way or if it's all my fault because Elijah said half of your interviewees knew who we were. So I don't know if we're getting you guys more popular. So I don't know if you even want that, but
I'll tell you, I had in this application cycle, we finished all of our interviews, but I had a fair number of applicants who said they follow your page and they saw our last video, which I think is great. And I think I said it last time, we want applicants to put together the strongest application possible so that they can get to the interview stage. So if doing these kind of interviews are helpful, then I'm all for it.
Well, yeah, I think it's a good thing because, like, if somebody sees you on camera, they hear you talk for an hour, and they really vibe with that, they're like, "This is the kind of program, the kind of person that I want to work with." Then, yeah, you're kind of finding each other, so that's a good thing. Optimistically, pessimistically, you're just getting to sift through even more applications because now you're online.
Yeah, it's okay. Yeah. It's a okay problem to have.
I'd say so. It's just funny. Elijah said that he's a second year now. He said he like exited the lecture room and then he looked across the hall and there was a bunch of interviewees and like half of them were like, "Oh my God, it's Elijah," because they knew him from the channel. Which
him and James, I think James is another one of our students that you interviewed, James Moore.
I got like 5 of your students on my channel at this point. But yeah, James Moore he's something else.
Yeah.
If anyone's ever discouraged, I tell them listen to his story.
Yeah.
Second, third chance, but now he's there. But anyway, that's one thing I did want to ask you is the more popular your program and other programs in general get, the more competitive, the more thousands of applications you have to review. How does that work with such a comprehensive process? Do you still do that much for every applicant or how does that work? Because you have a finite number of hours.
I think that for a lot of programs, we're trying to streamline the process. So for us, like we have a GPA requirement, but we also allow applicants to write a letter to explain if their GPA doesn't meet the requirement. So the applicants have to read the directions. So for those who don't write a letter and their GPA is lower than 3.2, then that's an easy way to filter out some applications because those who don't follow those directions, either they didn't read carefully or they, weren't reading the website. And so they're not as competitive. So that's one way that we can do it. Other things that we look at are the trajectory and the last 24 science credits or whatever the event is that caused an applicant to have a lower GPA. Does what they say vibe with what their transcript shows? So if an event happened, let's say their sophomore year, and then they say they got help or they recovered from it or, whatever happened, does their transcript align with the story? So if, let's say, somebody was assaulted, somebody had roommate problems, somebody's parent died, their fall of their sophomore year, we would expect to see bad grades their fall and maybe spring. But in their senior year, we would expect them to be better. If that
Yeah.
happened, but the grades continue not to be good, then they're not going to get the same review in the application.
Mhm.
So I don't know if that answers the question. There's no I've been very resistant to just not looking at any part of an application, um, if they meet the requirement of the GPA or a letter if their GPA is lower. So
Mhm.
that's an easy way to filter. I
Yeah.
I don't did I answer your question?
You did. I mean, I wish every program would do that to right off the bat, not have to do as much digging, just write a short letter, I don't know, 2,500 characters or less, explaining if you have a GPA that does not meet our minimum, why that happened. I wish every program would be that straightforward. I think a lot of programs probably don't want to, spend their time reading all those letters. They like to just kind of cut things off at an arbitrary point.
Right.
But just, the more people that apply over the years and the more letters you get, I imagine it's going to be difficult to keep up.
Um, I think that that's true, but the way that we do it is we have a we have multiple people who touch every application. But with those applicants who are in that situation where they need to write a letter to explain their grades, there's a subset of individuals who read those so that we really get good at at reviewing those letters and making decisions of where that application is going to go based on what the letter says. So
Sure.
we have a lot of experience doing this, and we can be efficient and comprehensive at the same time.
Yeah. Yeah, like I've said it before, I'll say it again. The Rutgers program is just exemplary in terms of application reviews, their admissions process, and their education process. I know because I have 5 friends in the program now, and they're all telling me that they're struggling. I mean, it's a tough program,
Yeah.
very, very tough. But man, does it probably pay off? Um,
I think
so,
also, and I'll just say, when we look at data, when students have been unsuccessful on the PANS,
hmm,
I just looked at this recently. It's never the people who have the lowest GPAs coming into PA school.
really,
That has not been Rutgers' experience.
really,
Yes, because we're careful about picking those people who have a 2.8, a 3.0. Their application is scrutinized to make sure that we feel confident that they can make it through the program. So oftentimes those students, again, I can only speak about Rutgers, those who have been unsuccessful on the PANS might have a 3.4, a 3.5 from undergrad. Their application actually might not be as scrutinized as some of those with the lower GPAs.
hmm,
So and I think in our last video you talked about the diamond in the rough, or that person whose GPA was lower, not because of aptitude, but because something happened,
hmm,
or they didn't have mentors when they got to college. They based on where their high school experience was, their family background.
hmm.
Like I said, something happens. That's what GPA just doesn't tell the whole story. I mean, I just keep repeating that same thing. One of the things that you asked me before we came to this video is you gave a scenario of somebody
Hmm.
who had, I think, like a 3.2. They went to an Ivy League school and they were having a hard time getting into school.
Yeah.
So, what I would say to that is that that person has a borderline GPA, even though it's okay for most schools. If somebody's not looking at where they went to school or the scenario around those grades, they'll be, you know, cut. If you're only looking at a number and not anywhere else in the application, the school is doing a disservice to that applicant and
Mhm.
also to the program.
Yeah, I agree with that completely. Uh, so actually, sorry, I'm just checking the TikTok here. TikTok just said they're restricting my live because they think this is unoriginal content because I'm filming my laptop. Okay, guys, it's original. This is me. But if anybody is actually in here and they want to ask a quick question that I don't have on my list, try to put it in, and I'll see if I can ask Dr. Palfreyman, who is the program director at Rutgers PA program. By the way, if you have not heard, I'd be shocked if you haven't heard. But the reason I'm having you on again is because I have a few questions from people that I just could not, in my experience, really answer. One of which being, like you just said, so I'm going to flip back to my Google Doc here. Uh, okay, so we're on the subject of low GPA applicants, probably the biggest topic that I get. Uh, the question is, what is best? Like, let's say you are in that boat where you have a low GPA for whatever reason. Is there a good reason? Is there not? Whatever it may be, but you want to be a PA. And I usually give people kind of one of three options. So you can do a formal post-bac, take classes on your own, or do a master's. Those are the kind of three options I've seen people do. Is there one that's best?
What I would say is it depends on the school. So I think a really important thing to do is make a spreadsheet of the schools that you're interested in going to.
Mhm,
Read the websites, see what they say, because some of the schools say, we only accept undergrad courses. We don't accept like the master's programs as part of the prerequisites.
mhm,
So the answer is going to be dependent on where you're applying. You know, some programs say we only want courses that have been taken in the last 5 years. Others don't say that. So it's, which comes first, the chicken or the egg? I think the answer comes down to what you're seeing. If you have a list of 5 or 10 schools you want to apply to, see what their websites say. If multiple programs say, um, you know, we don't accept classes that are more than 5 years old, then I would maybe take some of those undergrad courses again to help with the GPA.
mhm.
You don't see that. I think doing a master's is completely acceptable. So this is the nuance of what you want to do. The whole goal, whether you do a master's program or you take repeat undergrad courses, you need to take hard science courses and get A's. Because the reason we use the GPA is to show, do you have the aptitude to do well when you're taking 18 credits at a time?
Mhm.
So that's what you need to show. However you can show that is what you need to do. Is that too wishy-washy of an answer for you?
I don't think so. I'm just going to kind of spell it out a little bit more in black and white, and that is to say, you want to be organized in where you apply and what you do. So most people kind of they get to the application process and then they wish they would have done a bunch of things. Like
Yeah.
they get there and then they realize, oh shoot, my GPA is low, or I don't have this prereq or whatever, and now you have 1 or 2 years of work to do. So what Dr. Palfreyman's saying is make your list of schools that you would be interested in and see what their requirements are. Do they need their prerequisites within 5 years or 10 years like Rutgers or Duke? I keep getting in my comments like, oh, it's 7 years. It's like every school is different, guys. So for instance,
We don't have that at all because we look at the whole picture.
I thought it was 10 years for you guys for
We
prereqs.
we prefer
Ah,
10 years. So this is the nuance. We're not going to not accept somebody because one prerequisite is 10 years. You're
mm,
more competitive if you've taken them more recently. So this is the other piece.
mhm.
More competitive versus required are two different things.
Yes.
So understand the difference between those two things. Make the list of the schools that you're interested in. If you have a lower GPA, look for those schools that talk about holistic admissions.
Mm,
These are the buzzwords you want to see. Um, Look for the schools that say they will consider a lower GPA, and then focus in. If you have a lower GPA, focus in on the schools that will accept a lower GPA,
mhm.
and then read further to see, Do they have a year requirement? Do they have requirements that the classes all have to be taken in the US? Do they, whatever it is that they say, start making your list, and then that will help inform how you move forward.
Yeah. Yeah, absolutely. Kind of think from the end. Like today you
Exactly.
decided December 18th, what is that? 7 days before Christmas? 7 days before Christmas, 2024. You've decided I want to be a PA. Okay, so now you start getting organized. You don't start applying, you start getting organized. What schools do I apply to? What do they require? What do I not have? How do I do that? My GPA stinks. Okay. Do I need prerequisites? If so, you probably want to take a bunch of undergrad classes, get your prerequisites to get your GPA up. If not, if you've taken everything within a few years, maybe do the masters. I usually don't recommend masters unless it's something you want outside of the PA profession. Like you want to be a, MPH kind of person, you want to do policy, sure, get one. But if it's just for PA school, I don't think so.
Right.
I did have
And let
one.
me just say, Boris,
Yeah.
getting a master's in public health does not show that you can handle high level
Hmm.
science courses.
Totally agree.
You're doing your master's of public health to boost your GPA. We separate your overall GPA from your science GPA. So that
Yeah.
doesn't help your science GPA. So if that's your sole focus is taking courses where you're going to get A's, they better be hard courses,
Hmm. Hard science courses.
hard science courses.
Yep.
And that actually is a mistake that I sometimes see.
Well, and another thing is it's not going to be in your undergrad GPA, it's going to be in your graduate GPA, which is a separate bucket, which in some schools might get you automatically filtered out anyway because they
Right.
look at that undergrad GPA.
And that's
So,
right. And I just want to say that's another nuance is check with the school. So
mhm.
for Rutgers, your science GPA is all of it together. We look at your cumulative science GPA,
Oh, even with graduate?
even with graduate.
Oh.
So we see your overall science GPA and your overall GPA.
Mhm,
But we also, within the CASPA application, we see your every transcript by
mhm,
course. So if you have a 3.2 science GPA because you took graduate science courses, that will get you beyond the 3.2. The
mhm.
nuance is we look at every grade. We go through the whole transcript. So
Yeah.
what is the picture that this student is showing in their transcript
Mhm.
about how their ability is to be successful?
Yeah. I'm really glad we're on the same page with this because I've had so much pushback of people saying, like, I got an MPH, Masters of Public Health, and, then I got in. It's like, cool, but as somebody, like, I'm not involved in admissions, obviously it'll be a massive conflict of interest with my business, but, like, I probably would not really factor that in a whole lot. I'd probably want hard science courses, you
Yeah, I
know?
mean, I think that's good beyond be if you have a good GPA, if you go and get a master's of public health, that's not your problem in your application.
Yeah,
So
sure.
that can give you an understanding of way to think and the healthcare field and
Mhm,
science back research.
mhm.
So there's benefits in a master's of public health, but not if your problem with your application are your grades.
So would it make you potentially more competitive? Yes, as long as you've already shown that you can handle science courses.
Yeah.
Got it. I did have one question here on TikTok saying, I have a lower GPA, would like to apply to Rutgers. Who should I email the letter to? It's just part of their application, guys. It's going to be on CASPA
Yeah.
or secondary or something. It's going to be part of the official process. So you don't have to email it to anybody. Don't worry.
Correct. When you're in the CASPA application, you go through each of the fields and then it says, "Are there any other documents that you would like to upload?" And there is a place within CASPA where you can upload anything from your CPR certification
Mhm.
to hours signed off on procedures to a letter of explanation.
Mhm. Perfect. Yeah, would you recommend this? Would you recommend this for schools that don't specifically ask for it?
I It can't hurt. It's not gonna
Right?
hurt your application.
Like explanation of
Yeah.
low overall GPA, like a paragraph. I don't see why not.
I think if they have a place within CASPA
Mhm.
to upload free form documents,
Yeah.
it doesn't hurt. The other thing is sometimes people put it like in their essay, their main
Mhm.
CASPA essay, but you asked me about filtering.
Yeah.
I'm not looking in that main essay for the letter.
Mhm.
Our directions say, submit a letter. So follow the directions that are being asked of you. If
Mhm.
you put it as part of your main essay and I go into the application, I don't see there's another letter. You might get filtered out.
Mm.
Does that make sense
It
of
does.
what I'm saying?
It does. I know, like, it is definitely pretty common advice to include something about that in your main essay, just because they're applying to a bunch of schools and they're using the same CASPA essay, right?
Yeah,
So there might be a section on that, but if a school's specifically asking for a letter, like, yeah, include a letter. I
yeah,
didn't actually even think about that, even if they're not, because you can upload PDFs, you can upload Word docs of like your resume and stuff. I don't see why you wouldn't just include a short document explaining a low GPA, just standalone document, even if
ex
it's not being specifically asked for, like Rutgers.
exactly.
Yeah,
And you
that's a
you
great
just
idea.
you just hit on it. Yeah, it's fine if you put it in your main CASPA essay. Think about us receiving your application. It
Hmm.
comes in electronic sections.
Hmm.
So I'm gonna go if your GPA is low, I'm automatically gonna go to the section of the uploaded documents before I read through everything else. I'm gonna
Really
read that letter.
interesting.
Yeah, if there's no letter there and we say you need to have a letter,
Uh huh.
you're not going to be considered,
Oh,
right?
interesting. So even if you don't have a low GPA, you don't have
Yeah.
to.
No, if you have a low GPA, if our application says if you have a low GPA, in order
Mhm.
to be considered, you must submit a letter of explanation
Oh,
of
okay,
grades. So we're giving you the directions, submit a letter. That
okay.
doesn't mean put it in the main essay. Re
Oh,
so read the directions,
what she's saying is follow directions.
follow directions, because
Yeah.
that gives us also a sign. If an applicant doesn't follow directions, they're hasty, they're rushing, then you're competing against people who read directions.
Hmm.
Make yourself competitive.
Attention to detail.
Yes.
I tell people this all the time. I have actually, so like, obviously when people do a mock interview with me, they send me the CASPA application, the PDF, and I
Mhm,
get to review. I've reviewed hundreds of these at this point, and
mhm.
it's always shocking to me, like, how much stuff gets through.
Yeah,
Like, for instance, that I've seen a few where there was literally not a single patient care experience section. It was all healthcare. Like, that's how it was labeled. And it's like, shouldn't you technically have zero PCE? But the schools looked through that and they were like, no, this is actually patient care experience, not healthcare experience. The person mislabeled it, but they still got in.
yeah. But
With that.
I think put it in the right spot because this happens also, we require shadowing.
Hmm.
So sometimes people don't put anything in the shadowing section, but
Right.
they write about it elsewhere in their application.
Expect you to find it.
But I mean, that's pretty risky
Right.
because we're making the assumption that we're human beings.
Hmm.
We know there's places that we focus when we go through the application. Put the stuff where it's supposed to go.
Right. That's what the labels are there for. Like,
Yeah.
that's when I saw that. I was like, wait a minute, this is all healthcare, even though this is obviously a patient care experience. How did this get through? The person got in.
Yeah,
But
so they're lucky, they're
they're
lucky,
lucky.
but I think a lot of people get filtered out
Hmm.
because they're not putting things in the right spot,
Yeah.
and people take a hasty look because you
Hmm.
have to cut somewhere,
Yeah.
right?
Yeah, because like, if you have a gigantic pile of applications, you probably have like an undergrad, making $7 an hour, just like, all right, filter these applications for us so that we can only look at the ones that meet requirements. If that's happening, and if you didn't label something correctly, you could be just straight up filtered out.
Yeah,
It's certainly possible. It's the reality. Like, think about it from their perspective. You have 4,000 applications to review. You've got 50 spots. You got to probably, I'm not going to say cut corners, but you got to like be efficient
right,
somewhere. And if somebody mislabeled something, hey, we require shadowing, you have zero in shadowing. Next,
yeah,
it's just has to be that way.
yeah,
So yeah, guys, attention to detail. If a school is specifically asking for something, give it to them. Should
yeah,
go without say, but man, that's tough.
yeah,
Um, yeah. Anything else really on the low GPA topic? I think we've really beat that dead horse.
yeah, I think the only other thing is you asked about community college courses versus
Ooh,
online
that's a good one.
courses
That was a question.
versus one at a time.
Hmm.
What and I think when you take one at a everybody has different life situations, right? So if you're
Yeah.
working full time, you might only be able to take 1 or 2 classes at a time.
Hmm.
So, I think that that's fine. You better get A's. because you have to, because you're going to be coming into a program taking 15 to 18 credits at a time.
Mhm,
So those who have taken 15 to 18 credits of science courses at one time and have been successful, they're more competitive.
mhm.
You don't want to filter out those people who have to work, so they take one at a time. But if you're getting C's taking one at a time, you're not competitive.
Yeah.
Um, and I would say it's very hard at this point. It's hard to filter online versus in person.
Mhm.
So I don't think that it matters. You can't tell. So many public and private universities, the courses are online, and there's no way to tell that.
Yeah,
So
since COVID
don't worry
especially.
about that now.
Yeah. That one's tough. Like
I mean, we're looking at it because
Mhm,
my anecdotal opinion is that oftentimes online courses aren't as rigorous as in person,
mhm.
depending on how it's run. Um, it just depends on the course, but generally those grades are really good. But we can't at this time tell. So
Mhm.
we don't want to hold something against somebody because they took an online course, because others are taking plenty of online courses at Rutgers or anywhere.
Sure.
They're not denoted.
Yeah, like the transcript still says, "This is the name of the course, this is the school." It does not say online.
Correct.
Kinda wish it would, but
We've started asking which of the following, how many courses did you take online? But
Mhm.
we're not using that to make decisions at this time. We're just tracking it for data
Yeah.
to, for the future.
It's just so new. It's such a new situation since COVID. It's just like, we haven't adjusted yet. Uh, but yeah, that's a tough one because I remember Portage Learning. I'm not sure if you've heard of them.
Mhm.
They're through Geneva College in Ohio or Pennsylvania, and the transcript has always just said, Geneva College, which is a real institution. So you could never tell, even though these courses are like $600 and they're online and they're actually really easy.
Yeah.
Uh, but like, I'm sure admissions knows about that kind of stuff, but it's getting harder and harder. So I guess not a very clear answer to the online versus not online
Uh,
debate,
yeah,
but
and the
yeah,
only other thing I would say is that you have to actually know the information. The prerequisites are there for a reason.
right.
So if you take a super easy course and you get an A and you might get into PA school, you might struggle when you get there
Hmm.
because we have a certain level of foundation knowledge that it's expected. That's why we have prerequisites.
Correct.
So just, you're sort of kicking the can down the road by doing that. So
Yeah.
consider that when you're applying or making decisions.
I wish people would. Maybe I'm a little cynical, but I feel like people do what they're incentivized to do, and people think like, "Oh, I just need to get in, and I'll be good." And it's like, no, that's where it begins.
Yes.
Uh, but yeah. Anyway, did you need a break or something? Are you okay?
Could we just take one
Yeah.
my dog right now? I'm home.
Did you say your dog?
My dog my dog is here
Uh
and
huh.
pacing. She got into some Christmas items last night
Aw.
and ate some stocking stuffer chocolate. She was up a few times last night. Can I take a quick break?
Yeah. Can we meet the dog when she's done?
Yeah, I'll have her. I'll be really fast.
I'll take you off camera and I'll just chat with the audience for a second.
Okay, I'll be back super fast.
Thanks,
Thanks.
Dr. P. Oh my goodness, that is hilarious. Um, what was I gonna do here? Oh yeah, I was gonna try to switch my camera so I could talk to you guys. Flip camera. There we go. Hey, okay. So thank you guys for joining the live. This was totally not planned at all, but I was going to interview Dr. Palfreyman as it is. And, I just thought, why not flip the camera on and do this live? I'm not sure if you guys can even hear this when she's talking on my laptop, but there's kind of no other better way to go live at the same time with her while recording. So this is all I could do. Lindsay says, thank you for doing this. This is so helpful. You're welcome. You're absolutely welcome. Now, of course, I'm going to post this whole hour-ish long interview on YouTube, on TikTok, if TikTok still even exists in a few days. Like, I can't believe they're trying to take it down. That's insane to me. But, if TikTok still exists, if not there, please follow me on YouTube, Personal Statement Pros. Follow me on Instagram, Personal Statement Pros. Whatever app takes TikTok's place, follow me there in Personal Statement Pros. Like, we're going to keep this going. This business is going to keep growing. But yeah. So Dr. Palfreyman, if you guys don't know, she is the program director at the PA program, physician assistant program at Rutgers University. top 10 program. She used to be the admissions director there. So she knows what she's talking about. And her program is really known for being really holistic. They really, really take effort and time to review every single application. And, she's phenomenal. I think it's the best program in the country by far, absolutely by far. In terms of the quality of their education, it's hard. It's a hard program, but quality of education and also just that holistic review of each application. So, yeah, having Dr. Palfreyman on my channel for the second time for this long form interview is a real gift. So if you guys are in the live, or if you know anybody else that really wants to be in this live that could get some benefit, to ask her in real time questions, guys, she's here. She's here. She's going to be answering questions. So I know this was unplanned, but yeah, if you guys have a few minutes to join the live, ask her some questions. It would be a really, really stellar opportunity for you, because when she's going to be back on the channel, if she's going to be back on the channel, who knows? So there's things that I can relay to her. There's advice that I can give based on my conversations with her and many, many other admissions professionals. But having her actually answer your question right here in real time, that is gold, beyond gold. Okay. So really hope you guys take advantage. And sorry, I know this was unplanned, but before she comes back, she's back. She's back.
I'm back.
There she is. She's
I'm
back.
bringing my dog here. You can see her.
Oh, no, hold on. You're not on camera. Wait. I went to Rutgers for undergrad and I love the campus. Lindsay, thank you for sharing that. 1 second. Oh my goodness, it's a doggy.
I got a dog. This is Callie. She's
Callie or Kelly?
Callie, as in California. I'm originally from California.
Oh my goodness. Hi, buddy. What a cutie.
He's good.
Is it a golden doodle?
Golden doodle. Yeah.
Oh my gosh, she's so cute. I love dogs so much. Okay.
But I'm back and I'm focused.
Dogs are a necessary distraction to our lives. I can't wait to have time for a dog again one day. Okay. Anyway, thank you for sharing Callie. Is she okay?
Yeah, she's fine. She's good.
Okay. Anyway, all right. So I think we put the nail in the coffin of the low GPA discussion and the online versus community college versus all that.
Yeah.
People keep asking. So I thought I'd give you the podium to talk about community college versus online again. Obviously, preferences for your institution, more than one class at a time, preferably, right?
Yeah. And I just think about why the GPA matters. It's because programs want to know that you can be successful.
Mm-hmm.
So you need to explain why you can be successful.
Mm-hmm.
That's the key piece. Things happen in people's lives, but we want to know that one can be successful.
Mm-hmm.
So it's not just the number or even the GPA of where you take the courses. It's how you explain the GPA that is really fundamental to a program.
Yeah. Yeah, absolutely. So, I mean, if you need prerequisites, we're not saying you absolutely can't take them at community college or online or any of that. It would be preferable if you didn't, but it's okay.
Yep.
The fewer the better. I would say the fewer the better, but everyone's different. Yeah.
I agree.
Good. All right. Yeah. Same advice that I've been kind of saying, because it came from you. So
yeah,
most of my advice comes from someone who knows stuff. I don't know stuff. I'm just, a PA, right? I don't work in admissions. I ask people. That's why the advice that I relay comes from people like Dr. Palfreyman. So it's not just mine. But anyway, so next question on this list of questions here, real quick. All right. So how strict are grades for prerequisites? Will someone be immediately disqualified if they have a C- when they're required to have a C?
Yes.
And the 10-year-old requirement?
Yes. I think, again, directions. If it says you must have a C or better, programs are not going to count a C-.
Correct.
So you need to retake that course.
Yeah. Yeah. So a lot of the application is very subjective, but some things are objective. They're in black and white on their website. They say these classes must be taken within this many years with a C or better. If you don't have that, go get it. Right.
Right. And also think you're applying to programs to get 1,000, 2,000 applications. So why would a school make an exception if it says C or better? Why would they make exception for C-? Mm-hmm. There are 1,200 people who don't need that exception who might be qualified. So just follow whatever is required.
Mm-hmm. I'll give one example of maybe when that could be a thing, like for me personally.
Mhm,
So I graduated college in 2011, and I was
mhm,
applying to PA schools in like 2018 or something,
mhm.
2017. And some of my prereqs might have been more than 5 years old. And I think the school I applied to was around that 5 year mark, where they needed some amount of courses in the last 5 years or something. But I did a big post back that had some proprietary courses built into it. So they ended up kind of counting some of those as A and P and some of the prereqs and stuff like that. But I got straight A's in every single one of them except biochem, which was a B plus, which I'm still mad about. Um, but like, so that was a time when they kind of made an exception. They looked at the course description, like they looked at me more closely than they perhaps would somebody else.
Right. That's different though than what the grade requirement is different than
Yes.
what they would use to fill a prerequisite,
Yes.
right? Or
Yes.
so I think, but what you did is you reached out to each individual school and you explained your story. And
Mhm.
then in writing, you got the response to say, okay, we'll accept X, Y, and Z. And
Mhm.
that's a key factor too.
Yes.
I think when you have these questionable situations, always reach out to each school,
Mhm.
and I would put it in an email and then get the response in email so that you have that.
Yeah. Yeah. I definitely never advise anyone to pester admissions because that's going to get old quick, especially if you're doing it a lot. But if you have a legitimate question, that's kind of a good way to one, get it answered, two, get kind of on their radar, like, okay, who is this person? We've seen their name before.
Yeah,
Uh, I feel like that's kind of the only reason I got in. I also applied to two schools, which wasn't smart. But they're two schools I'd been talking to for years at that point, and it was actually those admissions directors' advice that I even do this post back. Like they basically said, "Go do this," and I did it, and I did well. So it's like that counts. That counts. It's not going to be an immediate fix, but like if your plan is years and you're willing to put in years, go do that.
yeah. No,
To know that.
that's good advice.
Yeah. Some might say, "Hey, no, we don't meet with students." Okay, fine. Go to a different school, I guess.
Yeah, and I mean, I I agree with that. I think you start to decide where you're interested in applying by
Mhm.
some of these experiences. Do people email you back?
Mhm.
Can you get in touch with whether it's a staff person or a faculty member?
Mhm.
Gives you an idea of what it might be like to go to that program.
Mhm.
So I think all of that is important.
Yeah, yeah. Could not agree more. Um, Also, I'm seeing some people are sharing the live. There's hearts. Okay, half an hour in, people are finally like, "Oh shoot, he's live." Okay, so we might get a few random questions from the audience if that's
That's
okay for
okay.
you, Dr. Palfreyman.
Yeah.
Um, but I'm going to move on to my next question here, which was, so how strict are grades for prereqs? The answer is strict. If it says C minus or if it says C, C minus does not count. You must get a C or better in the prerequisite.
Yes.
Case closed. Um, this person, we talked about this Ivy League person who did very well overall, but still couldn't get in. She had one prerequisite that was a C minus, and that might have been why she was rejected by 14 out of 14 schools. Um, so there's that. Do graduate courses fill prerequisite requirements? For some schools, yes, but maybe not for all.
Yeah. I would just double check to see what the websites say. Read
Yeah.
every website very clearly.
Hmm. And if not, email them. Let's
Yeah.
say I don't know, you did your undergrad 10 years ago, you just did a master's degree in physiology. Does that count for the A and P requirement? For some schools, maybe. For some schools, no.
Yeah.
Right. So,
And a hint say, I noticed on your website it said this, but I'm still not clear about
mhm,
whatever. It
yeah,
shows them that you looked at their website
yes.
because when things are clearly put on the website and people email us, you're like, "Did you look at the website first?"
Mhm,
It's you talked about time,
mhm,
that's the kind of attention you don't want if things are so clearly on the website.
mhm,
So if you just start your email with, "I looked on the website and it wasn't clear," then that's a good way to email.
mhm. I want to make that point again. I'm just writing down timestamps of extremely important points. So reaching out to admissions. All right. So our advice from like a couple minutes ago was reach out to admissions, get on their radar, ask them good questions. The total opposite side of that is don't ask them silly questions.
Yeah,
Like
Yeah,
If
I
you
mean,
email admissions and you're like, "What's their minimum GPA?" They'd be like, "Are you kidding me? Like, look at the website."
I'll give you an example. So my email, I get emails from people all the time. You can find it on the website. Somebody email, Dr. Palfreyman, do you have a requirement for science GPA and overall GPA?
Yes.
I think to myself, website? You know what? It's so obvious, but there's some things that are not obvious. So, that read the websites. That's why they're there.
Yeah, I think that might be the biggest piece of advice I give as far as reaching out to admissions and also during your interview. Prove that you did your due diligence and you went on the website, right?
Yeah,
Like, this is exactly how this was worded. I'm not really certain in my case. Does this apply? Like, that shows that you're thinking, you actually cared, not just, oh, I'm trying to get an easy, McDonald's drive through answer. Like, I actually care about this. I'm doing something, right?
yeah. No,
Yeah.
I mean, like I mentioned at the very beginning, I had applicants who said, "I saw your video with Boris and you said X."
Hmm.
Now, I don't take that all as that they're, trying to impress me. It showed me that they then take how that moment, whatever that was that you saw in this video, and
Hmm.
how does that apply to your life? To me, that shows you're doing your homework.
Yeah. And if you could also cross reference that with the website, that would be
Exactly. Yeah.
10 out of 10. So yeah. So if you're reaching out to admissions, don't just reach out with silly questions that you could answer yourself by looking at the website. Use specific verbiage from the website to really ask the question. If you have a question still, nine
Yeah.
times out of 10, you probably won't,
Yeah.
you know? So yeah, definitely good advice. Next question here. So do graduate level courses fulfill the prerequisites? Some schools, yes, some schools, no. Check the website. If it's not on there, ask them. International students. This one is, I'm sure there's a whole process and I'm sure it's on the website. But, TOEFL, that exam, but I don't think they really apply any differently than anyone else, minus the TOEFL.
Right. What I would say is, again, look at the website. Some programs will not accept any international courses.
Hmm.
Some will. So for Rutgers, if you did your undergrad internationally, you need to submit the TOEFL.
Hmm.
We also they need to, and the name is escaping me. They have to do the transcript review. There's the company that does the international transcript review to that does it. I can't remember what it's called. But we will accept that transcript. Whisk,
I have
right?
no idea.
Okay. Anyway, we'll accept that. Other programs don't. So again, read the website to see if you need to retake all your prerequisites to
Hmm.
be here in the US.
Oh, so if they have that, whatever it is, American, whatever it might be, then they might even have their prereqs counted. But if they don't, then their undergraduate degree counts as the bachelor's degree requirement, but they might need to retake just their prereqs.
Or all of them. It depends. I'm not as familiar with that because we accept, we have people who, I was a physician in my home country, and
Mhm.
so we do the transcript review and we accept their international courses.
Oh, cool. So
But
they
I
might not
know
even need
for a fact
prereqs.
that there are other PA programs that won't accept those.
Sure.
So just know which way it is.
Yeah.
Other than that, there's they apply like anybody else.
Mhm. Yeah, still CASPA, still all your courses,
Yeah.
that kind of a thing.
The
Letters recommendation.
A piece of advice I have for international students, even if you were a physician in your home country, most programs, there are a few who give you advanced standing for that. But
Mm.
for many programs, including Rutgers, you start at the beginning like everybody else.
Mhm.
So, read the website and see how that works. And it is a little off-putting sometimes when assumptions are made because somebody was a physician
Mhm.
elsewhere.
Mhm.
They sometimes feel, sometimes get angry, short with us that we're not giving them advanced standing. So
Really?
I wouldn't do that. I wouldn't do that. Just understand that that's the process and whatever the
Yeah.
process is, and then you can decide if you wanna go to that school or not. but
Yeah.
it's not helpful to argue with the admissions team who's making the decisions about
I guess that's so obvious. I can't even imagine arguing with somebody that that just makes no sense to me. But
yeah.
I could see it from their side, like, oh, I'm a physician and like this is a physician assistant program, but you can't really be entitled, guys. They have a 1% admission rate, and it doesn't have to be you.
Yeah,
So
and you're applying to be a PA, not a physician. And so
correct.
while some of the science courses are the same, the philosophy could be slightly different.
Hmm.
And when one argues about it, then we call into question, do you really know what a PA is or
Hmm.
what your place, if you will, with
Hmm.
in the healthcare team will be?
Sure.
If demands are being made because one is a physician from elsewhere, then
Hmm.
that calls into question what you might be like as a team player on the healthcare team.
Yeah.
So it's, that's my thinking.
Yeah. Good rule of thumb. Don't argue with admissions.
Yeah. Or the
Yeah.
people or the staff members who answer the phone, because we all talk to each other. And if one is rude to the staff member that
Hmm.
one might view as a entry-level secretary or
Right.
admin person, then what might you be like when you're here? So be nice to everybody. Don't assume that we don't talk.
Yeah. That's one of those things I didn't even feel the need to say because that should be so obvious. Same goes for your interview. Like if it's an in-person interview, you're checking in, whoever's checking you in, whether they're, a current student, secretary of some sort, whoever's like picking up, wearing a neon vest, picking up cans in the parking lot, be nice to everybody, just as a human being, not even as an applicant. You know what
Exactly.
I mean? But,
Anyway, do that no matter what.
yeah, right. Like, should go without say. Just be nice to people. As a rule of thumb, I get it. People get frustrated, but dang,
Yeah.
I can't imagine like trying to apply to someplace and then being rude to them on the phone.
Yeah.
Anyway, okay, so that's good advice for international applicants for sure. So that's a good one. Okay, so some schools yes, some schools no. Check the website. If not, you should certainly reach out. Okay, so that is the process for international students. For low GPA applicants, we definitely answered that thoroughly earlier.
Mhm.
We talked about restating your thoughts on people who want to boost their GPA or take prerequisites at community college versus online versus anything else. Okay. Another super duper common question. Does this count as PCE?
Yeah.
Uh, Now, I'm sure your website, just like every other PA school website, has a list of acceptable experience. If someone's job is more specific, if it's not on that list, do you recommend just reaching out?
Yeah, I would say patient care means that you are patient facing. It's not administrative like front desk work.
Hmm.
Absolutely not front desk work. Have you interacted with a patient in some medical way?
Hmm.
So, there's a continuum of what is there's 2 answers, I guess, Boris. What's required what is allowed and not allowed versus what's better than
Hmm.
others.
Hmm.
So I think that is a key point here. So I think being an EMT is great. You get
Hmm.
100, right? You get if you looked at a scale of 0 to 100, being an EMT is 100.
Ooh, okay.
Being a, being a front desk person is a 0,
Right.
okay? So all of these things in between, you gave some examples to me like, physical therapy tech. To
Hmm.
me, I think that that is a if you're interacting with the patients, putting ice packs on, helping out, then that's patient care hours.
Hmm.
Um, I think phlebotomy, we would say, yes, you're interacting. You're doing a procedure. You have a skill and you're managing the patient in those moments. A pharmacy tech, I would say no,
Mm.
because you're not really medically managing the patient in any way.
Right.
Right? So for now, if you have an exception, you could make the case for it, but generally, I would say pharmacy tech, no. Um, Cardiac monitor tech, it depends what you're doing. What is involved in your role? Are you
Hmm.
engaging with that patient in some way? A
Hmm.
scribe, I would say it depends. So a lot of people scribe. Are you just going in as the PA or physician shadow and documenting all of the questions that the healthcare provider is asking? To me, you're not you're that's secretarial or in
Mhm.
admin work. You're not engaging with the patient. Other scribes are engaging with the patient more.
Mhm.
So what it's not just the title of the patient care experience. It's what you're doing in that role that matters.
Mhm.
So this is the nuance of, I wish I could just say yes, no. And I know some schools say yes, no,
Mhm.
their website. I think the reason we want patient care experience is to know, do you know what it's like to take care of patients? Do you know what it's like to engage in that vulnerable provider patient role?
Mhm.
Do you know you're comfortable with fluids and being in this setting?
Mhm.
So you need to have jobs that show that. So
Yeah.
again, does that again, I always feel like I get so wordy, but there's, you know, that's what I think.
That's a very good explanation. Are you actually in it? Are you actually hands-on? So, like for instance, based on that description, my scribing hours would not have counted. I mean, I was actually in the ER with the provider. I was seeing everything, smelling everything, hearing everything, but I wasn't actually, hands-on with patients at all. It was just completing the chart.
Yeah.
Um, but my
I
school
would not
practical.
think that that would be as good. To me, we might accept it, but it wouldn't be as good. I'd
Mhm.
rather have somebody who was a nursing assistant,
Mhm.
um, or a medical assistant because they're engaging with the patient.
Mhm. And then the higher the level of decisions that you're making, such as EMT, that's the better it gets.
Yes.
Right. Okay. So some confusing ones. I've definitely gotten cardiac tech monitor. If you're just watching monitors all day, you're not actually touching a patient or looking at the patients or doing anything with them except for just handling the monitors. That's probably a no go, right?
Right.
So that's that one. Physical therapy tech was another big question. You're probably going to be interacting with patients, like you said, giving ice packs, helping with exercises. So that's probably fine, right?
Yeah. If you're putting the patient in the room, talking to them, finding out like, how are you feeling today before the PT comes in and putting ice packs on? Are you comfortable? Yeah, I think that that's fine.
Yeah. Somebody just asked, is EMT or medical assistant better? It sounds like EMT probably. You're much higher level decision making.
Yeah.
Yeah. So EMT, I mean, if you have the choice, EMT versus MA, it's just that most MAs go through a pretty short training, if any. Sometimes they're trained on the job, and EMT is a pretty strict, structured training for a few months to weeks.
Right.
So yeah,
Both
if you have the
both
choice, EMT.
both are acceptable.
Yeah.
One makes you more competitive.
Yes.
Lots
100%.
of people get rejected from PA school who meet all the prerequisites, who meet all the requirements.
Hmm.
They're not as competitive.
Right. So most competitive, or not most competitive, most common experience is CNA or MA, just because they're the easiest to get. But if you want to be competitive and you like emergency medicine, that kind of thing, go be an EMT. That's a good one.
Yeah, but if you become an EMT, but you have a 2.5, it's
Right.
holistic, right? You have to look at your whole package.
100%. I've seen surgical tech. I mean, that person's definitely hands on. They're doing stuff with
Yep,
patients.
yep,
Surgical tech
that's
should
good.
count. Yeah, 100%. Surgical tech, dental assistant, same thing. They're with patients a lot of times on their own.
Yeah. Yeah, I would say dental assistant, yes, but we really ideally want somebody who's dealt with medicine.
Mm,
So if you're going into dentistry, being a dental assistant is good. If the only experience you have is dental assisting and now you wanna go to PA school,
hmm.
my question would be, how do you know that? Where
Aha.
how do you know you wanna be a PA?
Hmm.
So, it might be dental assisting because that's what you have to do and you work full time, but you
Yeah.
better have a lot of really good PA shadowing.
Yes.
So that might help a little bit
Mhm.
bridge that gap. But if you only have dental assisting while you've been with patients, do you know what it's like to be a PA? You're
Sure.
applying to PA school.
Probably same thing with PT assistant, right?
Yeah, and I think I've said this before. Being a PT assistant is fine. I wouldn't get your shadowing hours in orthopedics. You might
Mm,
have some there, but I would definitely seek out hours in pediatrics, in medicine, in OB, in somewhere else beyond orthopedics. Because if you work as a PT assistant, you know Musculoskeletal patients. Do you know what it is like to deal with somebody who has cancer, who's ill? PT patients are not ill. Do do does that make sense?
It does. I'm just muting myself because there's a train going by, and
Oh, okay.
yeah, there's a requirement where they have to like honk their horn whenever they come to an intersection, but some conductors just go beep and some just lay it on for 5 minutes.
That's funny.
Um, yeah, so that's why I'm muting myself. But yeah, it makes a whole lot of sense. And I'm really glad you explained it that way, because yes, you're technically hands on as a PT assistant, but if that's your entire experience, you haven't really done much of anything else medically. Whereas a medical assistant, you've checked people in who are on all kinds of medications, you've seen all kinds of stuff.
Yeah,
CNA, same thing. So PT assistant, dental assistant, anything that's kind of like medicine adjacent, but is very, very specific. Maybe at least get some high quality shadowing elsewhere.
yeah. Some
You know,
different kind of shadowing.
ooh, here's a really good question. Is it better to have a variety of patient care experience or focus on one?
My answer would be variety,
Hmm.
because you go through PA school, you see a variety of patients.
Sure.
So if you've only dealt with children, do you know what it's like to deal with an 80-year-old patient with cancer?
Hmm.
If you've only, one kind of a nuance here, sometimes people have a lot of experience in the mental health area,
Hmm.
right? They've been counselors or, have worked in different mental health areas, which is
Sure.
great patient care, but do you know what it's like to deal with a sick person?
Hmm.
So I think a variety is good.
Yeah.
That's the ideal.
Hmm. Yeah, and I mean, like she said before, everything's nuanced. If let's say you have two kids and you've been a dental assistant for 20 years and you make better money doing that than being a CNA, you got to keep that job and keep your family afloat. Understandable, but at least get like 3 or 4 hours of shadowing a week for a few weeks at, an ER or something, right?
Yeah.
Yeah. So variety's good. It's nuanced, but yeah, if you can be like 6 months as an EMT, 6 months as a CNA, 6 months as something else, I mean, that would just be prime.
Yeah. I mean, I see people who were PT assistants
Mhm.
and but they spent 15 hours in a derm office
Sure.
shadowing. They spent 20 hours in a pediatric office
Mhm.
shadowing. That tells me a little bit more that, okay, they have an idea of the breadth of patients
Sure.
and they want to go into this. They know what
Mm.
they're getting into.
Yeah, because I mean, your rotations, even if all your experience, let's say, is in PT, your rotations aren't going to be all ortho. You're going to be doing all kinds of stuff, So it's
Ortho
you
is
know
just a small part of one specialty.
particular. Yeah,
It's
exactly.
only a surgical specialty.
Mhm.
The vast majority of patients are ill,
Right.
so
Yeah,
medicine is ideal.
100%. So I guess the answer is it better to have a variety of PCE? Yes. But if you can't get that or it's not practical, then at least get shadowing in multiple specialties, which that should be quite
Yes.
practical. Tiana says, thank you. You're welcome, Tiana. Okay. And then, so dental assistant, we talked about pharmacy tech. You said, unless they're very much patient facing somehow, probably not. Scribe, we talked about. Phlebotomy, you said yes. Dental hygienist, kind of same thing as
I
dental
would say
assistant.
yes, but you need to see some medical patients.
Yeah. Yeah. At the very least in
Well,
shadowing,
yeah,
at the very least. Okay. With PA school getting more competitive, I think we talked about this. You've got thousands of applications. What is the
I saw
there
your
it
last
is.
question, right?
What's that? You saw the question?
The developing versus a continuing accredited program? Were you
Oh
gonna
no, that's later. But I mean,
okay,
wait, live will end in 5 minutes. Okay, that's fine. We only have like 5 minutes to go.
okay,
Quit advertising. What are they doing? Oh, wait. Oh, okay. They're making me prove that I'm a human.
okay.
TikTok. I swear to goodness. Anyway, okay. So I mean, the it factor as far as getting people in, we've beaten the whole application thing with a. We're good.
Yeah.
Your opinion on developing versus provisionally accredited programs? I've got opinions, but what do you think?
I mean, you have a more of a sure bet with a program that's a continuing program.
Hmm.
I think if it's provisionally accredited, I would just ask a lot of questions of where they are in that process.
Hmm.
Um, I would ask questions when if you have an interview there. I mean, a lot of them, they're provisional only because they haven't had the time. So there's a process
Sure.
you have to go through. So I think there's some schools that are going to be great that are provisional,
Mhm.
that are just in that process
Just because 'cause they're new.
just because they're new. So I
Yeah.
don't think that's a bad thing. Um, I wouldn't absolutely not go to those schools, but you wanna look at how many those schools, I might ask a little bit more questions about how long the faculty, what's the experience of the faculty, ask questions about the curriculum, ask
Mhm.
about how, where they are in that process. That's
Mhm.
because I think those are the things that are gonna give you a better idea
Mhm.
if, the program is going to eventually get continuing, uh, accreditation,
Yeah.
right? So if it's a provisional school, brand new faculty who've never had any experience in PA education, to me, I might think twice about that.
Mhm.
It's a provisional school that has brought in faculty from other programs that have had years of experience running a PA program, I'd be less worried about that.
That's a really good point. So the advantages of a new or developing program is they're gonna be less competitive.
Yeah,
Uh, Disadvantages is you could get yourself into a situation that's less than ideal, because being in the first year of any program, regardless of who's running it, is tough because you don't have mentorship. It's not a tested curriculum. You don't have tutors because nobody's done the class before, right? So it's just there's a lot
yeah. What's worse is if you're in a program and it gets shut down.
that too.
To me, that's worse. The
Yep.
worst scenario you can get into is if you're in a program and it gets closed. It loses its accreditation, and then you're out of luck.
Yeah, you don't get anything out of
That's
it.
even worse. I mean, even with the school when you're the first class, listen, if it's the only place you get into, every school has bumps. Nothing's smooth anywhere, including the
Sure.
programs that have been around for 50 years. There could be some bumps in the road, but I think if you are self-motivated and flexible, you could go to a school and be a first class.
Mhm.
If those are if the pro if you feel confident, if you feel confident about their admissions procedures and process, you felt good with the faculty and the staff when you went there,
Mhm.
these are all clues as to what the program might be like. So
Mhm.
I think that would be okay. But if they're scrambled, they never get back to you, everybody's brand new, everybody's kinda like, "Ooh, don't know what's going on."
Uh-huh.
I wouldn't pay attention to those red flags.
Yeah, be cautious. Just gonna say, if anyone's watching on the live, last call for questions. We're gonna wrap this up in the next couple minutes. But my little piece on that, just because I've had people reach out to me just kind of for help. They're saying like, "Hey, I'm in a first year of this program. They're totally disorganized. The professors aren't being helpful. There's no mentorship or tutoring because we're the first class. What do I do?" And there's kind of not much to do. I say, ask the students who are successful how they're studying, what they're doing, but that's about all you got. But that's kind of the nightmare scenario is there's
Yeah,
no
I
help.
would also say the ARCPA is there to help you. Part of
Ooh,
their role
okay.
is to protect the public, protect
Mhm,
students, and so if you have grave concerns about the program you're in, you can reach out. You can go to the ARC website and log a concern, and then
mhm,
they will investigate,
mhm,
and that's not saying something bad about your program, it's trying to help you get the resources that you need.
mhm.
So
True.
and students do that, and the ARC does follow up.
That's something I haven't thought of. If it's if you're in a program and it's the first year of that program, or even if it's not, if the program's been around for 60 years, 60 years. Yeah, I guess some might be 60 years old now. Duke is about 60. Um, but yeah, and if there's something that's a legitimate concern, talk to all your faculty about it. Please don't like just go to the higher ups. But if there's something drastically wrong, that is what the ARCPA is there for. And what is it, AEPA, or there's an actual like PA education body as well.
You have PAEA, which is
PAEA.
the Educational Association.
Mhm.
The ARCPA are the accrediting body.
Okay.
So if they get complaints, they investigate. It doesn't mean the school is going to get into trouble. It
Right.
simply means that their role is to provide oversight to make sure that the programs are meeting whatever the standards are. And
Mhm.
if there are grave concerns that are not addressed, like you said, have it go first to the program. But if
Sure.
you feel like you're not getting anywhere, then you can log a concern.
True. Didn't
And I
really think
and
about
I
that.
I don't think that that's a bad thing to do.
Mhm. After you've done your due diligence and talked to the program about your concerns, don't just, go over their head.
Yeah.
Uh, but yeah. And then last question here, is it common for schools to require you to set up your own rotations? I don't think any school requires that.
Uh, I think that the school, according to the standards, is required to, have appropriate numbers of rotations for their class.
Yeah,
We
I
might
feel
for
like
electives, I mean, there might be a nuance in there that I'm not aware of. Um, but it is required for a program to have appropriate number of clinical sites to train their students.
yeah, I don't think they can require you. That's on them. They might appreciate it if you have your own rotation to set up
Yeah,
if it's a
they
high
might
quality
have
one.
options. Yeah,
But yeah, they can't require that, I don't think.
no.
Let's see. All right. And I think that'll do it. I mean, we got more people joining every minute, but we're going to be respectful of Dr. Palfreyman's time. I think we answered all of the common questions that I've gotten here. Um, your opinion on developing versus provisional questions. Oh, here we go. Okay, I've got one more. Do you have 2 minutes for one more? So this one's about interviews. I don't know why we haven't talked about interviews at all because it's kind of interview season right now, but this one's interesting. So, how perfect does somebody have to present in the interview? Of the accepted people you saw last year who were accepted, how many of them just went smooth like butter and were ultra professional with everything? And how many of them were able to freeze and stumble and be human and nervous at times?
I would say, we don't want a robot perfect person. We want somebody who is authentic. So if
Yes.
you're talking about something that's challenging, then and they, stumble a little bit or they freeze or they get uncomfortable or sometimes people get teary because of whatever they're talking about,
Hmm.
that's okay. It's authentic. I think if where people have problems is if they are so nervous that it becomes debilitating throughout the entire interview,
Hmm.
then that becomes more of a challenge.
Hmm.
They're not as competitive. We think to ourselves, they're not ready.
They're not ready.
So you don't have to be perfect. We
Hmm.
don't want perfection. We want authentic.
Hmm.
Um, but if you're so nervous or have such a hard time articulating your thoughts, then you may not be ready.
Hmm.
So that's what I would say.
Yeah. And I would say from advising people like this, you might absolutely be ready academically and professionally and everything. Uh, if you're really just having that much trouble interviewing, you got to practice,
Yeah.
practice, 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 practice. That's all you can do,
Yeah.
and that's what people don't want to hear because it takes time, effort, and work, working on something that you're not good at. But that's how you get better at something you are not comfortable at is by doing it.
Yeah. And you're going into a profession where all you do is talk to people all day
Right?
and connect. So
Yes.
that's what we're looking for. We're looking for that person who can connect with other human beings. You've
Hmm.
already shown you're smart enough or you wouldn't be in the interview.
Right.
So we're looking for those people who have that piece. It doesn't mean you have to be like gregarious or totally extroverted. We need all kinds. And we as human beings need different kinds of providers at different times, right? Who we're
Hmm.
dealing with, if we're going with a sports injury, might be very different the kind of provider we need when we get a diagnosis of cancer,
Yes.
right? There are different nuances there. So we want providers of all different kinds and all
Mhm.
different kinds of personalities. The thing we do need is we need providers who can speak, who can show empathy, and who have good connections with others.
Mhm.
And so you need to show that in the interview. And if you're so nervous and paralyzed that you're unable to show that in the interview, then you have to remember there are hundreds of others who were able to show that in the interview.
Mhm. Yeah.
So, there's only a limited number of spots.
Yeah. And I mean, if you happen to be very shy, very introverted, not, quote unquote good with people, one, I don't really buy it because you've had patient care experience, in which case you've had to be good enough with people or you wouldn't be able to have that experience.
Yeah.
Um, but if you're not, if you're nervous, you can improve that in just a couple weeks by
Yeah,
just doing practice.
sure. I don't even mind, like, sometimes people will start and they'll say, "I'm really sorry, I'm just really nervous." And we
Sure.
say, "No problem.
It's okay.
Have a drink of water. It's okay. Everybody's nervous. This is a big deal.
It is.
Why don't we reset?" And then we reset. And then if they can get it together, then we don't even I never think twice about it.
Sure.
Or people say, "I'm really shy. I used to find it hard to, speak up, but
Mhm.
I've really worked on it. And
Mhm.
this is what I've been doing, and every time I walk into a patient, I do act I walk into a room." You can address that you're shy.
Mhm.
Just say it, but talk about how you're overcoming it. If you
Mhm.
don't and you're just shy and so quiet or soft-spoken that you barely answer questions, that is not helpful. That's not
Mhm.
good for you. So just address it's no different than the GPA or whatever. Address it if you know it's something that you need to work on.
Yeah. And no one's saying you have to have the confidence of a provider that's been practicing for 20 years on your first day interviewing, but some touch of that, because you got to think, like, we're evaluating you to be potentially a medical provider, people's lives in your hands. Imagine you walk into a room, you're very worried about your chest pain, and your provider who comes in, they're so nervous that they can't even talk to you. You're like, I'm even more worried now. I'm terrified, right?
Yeah.
Like,
I
you got
mean,
to show some confidence.
some programs, you start seeing patients in some capacity from the very beginning.
Right.
So you have to be of that place
Hmm.
to be able to do that.
It's a people profession.
Yeah,
It
absolutely.
absolutely is. But I don't want to discourage anyone who might be very shy or might be not super good with people. I promise you guys, as someone who like literally stumbled and mumbled and what do you call it, stuttered? Yeah, like all the above, all of them when I was younger, and still do sometimes in certain situations, but extremely rarely now. But like you can overcome that actually pretty quick by doing what you're bad at and practicing. Like
Yeah,
it's just like anything else. It's like throwing a frisbee. You do it 100 times, you're going to get better at it. It's the exact same thing. I promise you can get better at it.
absolutely. And we don't want 50 like big personality dynamic,
That would be
woo,
so annoying.
kind of people. Imagine a class of 50 of that. We have
That
that.
would
We
be so
need all
frustrating.
kinds. We need all kinds.
Yes.
So
Yes.
we have tons of students that are soft-spoken and introspective
Mhm.
and analytical and listen before they speak.
Mhm.
Those are all really amazing traits. But one who is quiet, who's nervous, who listens before they speak, when they speak, one must be articulate in some
Mhm.
way.
Yes. Yeah. So,
And as you said, preparation matters. It
mhm.
does. There's this you say it out loud to the mirror. Say your answers out loud. Don't just write them on a piece of paper.
Mhm.
Out loud when you're driving in the car. Say it to your family member, your roommate, your dog, whoever.
Mhm.
Because writing something on a piece of paper, but actually saying it in a conversational way is
Mhm.
two different things.
Yeah. It's I mean, I'm no neurologist, but it's just wiring your brain to actually do an actual activity. Like having a thought and producing speech is an activity that takes practice.
Yeah, and
You know?
segue words are important. Therefore, in the meantime,
Hence,
whatever
my
it
favorite
is.
word.
Yeah, at the same time, therefore, this is how I whatever, those are good words to practice.
Mhm. I think I use hence more than any human on the face of the earth because I used to be a scribe for Dr. Oh goodness. Very, very long name, but one of the most brilliant physicians I've ever met. Super thick accent that it was hard to scribe for the guy, we'll say that. But he used hence almost all the time. It was like his go-to. And
Mhm.
it just always made me happy because I'm like, all right, this is the end of the MDM because I know that he just said hence. So
Oh,
it was just made me happy. And
no,
like from then on, I put it in all my notes. Hence, this was ordered.
All
Uh,
right.
you don't
We all
have to
have
do
our
that, by the way.
words,
It's a
and that's
weird word.
okay.
Yeah, it's okay. But anyway, uh, I think that's all we got. Dr.
Okay.
Palfreyman, thank you so much for taking yet another hour of your life to talk to these pre-PA kiddos, trying to get them help.
Always happy to help. Always, available too. I've had people from the last one, people who reached out, sent me emails,
Mhm.
and I'm happy to help clarify anything else.
Absolutely. Do you have any parting words for the audience?
Um, I would just say that, uh, I would say follow directions, be confident in yourself, uh, and and that's pretty much it. Read directions and be confident.
You could tell she's
Mm,
probably
come
gotten a
up with
few.
a plan and come up with a plan. I
Yes.
think and just to go back to the very first thing we said, do some research into schools that you're interested in, get a
Mhm.
feeling for what they're looking for, and then set up a plan 1 year, 2 years before you apply. And focus on what those schools are looking for versus doing all of these amorphous activities, not knowing where you
Mhm.
might end up applying because you might be wasting time, money, and energy on doing things that may not matter for certain schools.
Think from the end.
Yeah.
Like Snoop Dogg character in a Starsky and Hutch. He ended up on the boat and he caught the bad guy, and they're like, "How'd you get that?" And he's like, "I started at the finish line." And they're like, "Do you want a job with the FBI?" And he's like, "No." But anyway,
That's a random, um, reference, but I love it.
have you seen Starsky and Hutch?
You mean like the old see, I think I watched it back in, like, the '80s. Is there
No,
a
the one from 2000 with Owen Wilson, Ben Stiller, and Snoop Dogg.
oh, the movie. No. No?
They You should. It's hilarious. It's
I'm
a great
glad I'm
movie.
dating myself. Yeah. Starsky and
uh,
Hutch. Yeah, I used to watch it back in the late
I mean,
'70s.
90s kids, we
Yeah.
think in movie references.
Yeah.
So that's me. And I'll never forget that. He was the funniest character. But so I'm going to end the live here. Thank you, Lori. And thank you,
My pleasure.
Boris.
Good luck.
Absolutely. You're welcome, Tiana. You're welcome, Daria. How do I end this? Because I'm going to stop the recording and just chat with you offline just for a second. But you know what? What if I do this? Yes, end now. Hey, there we go. Okay, cool. 202 viewers on the live that I never even announced. I'll
Okay.
take it.
That's pretty good.
I'll take it, and we're going to end the recording now.